Hello, hello. My name is Hoda Asghari. I am the practice manager at Revive Surgical Institute. For those of you who have been to our office, you probably have met me, or at some point in your journey, you have talked to me on the phone. I am very excited to be at the headquarters of MedMiami. I'm here with Natasha, who is the founder and owner of MedMiami, who is the private home health agency that we use to provide the aftercare for our patients.
Thank you. Well, welcome. So
Thank you.
glad to have you. We have been doing this for a little over, we're actually almost at our 8-year mark.
Our collaboration with MedMiami and with Natasha started about, I want to say, 3 years ago, primarily because we felt, and Dr. Asghari's strong feeling was that there was always a gap between the OR and the care at home or wherever the patient was recovering. The challenge was that we knew that we were providing our best quality care to the patient in the OR. We're doing the best we can to make sure patient is as stable as possible during PACU, but we felt that we did not have a good quality control over what happens when the patient leaves our center. And we wanted to know what is going on with them, if they have pain, if they have any fluctuations in their blood pressure, if there's anything going on with them that is concerning to them and is something that we can help with. That gap existed there, and we felt like our patients, when they leave, they don't really have our protection. So we wanted to be there for them. We reached out to MedMiami, who is one of the very few licensed home health agencies in Florida, and we are very fortunate to have them. And basically that allows us to make sure that when our patients go home, they are supported and they are not overwhelmed when they go home or to their recovery location, whether it is hotel or Airbnb, wherever they are staying at and wherever they are recovering. They feel that they are supported. They still have the backing of the recommendations from their doctor there, and it's someone that knows what their doctor wants, what has been done in terms of the surgery that's been done for them, what is the recommendation for that surgery, and to make sure that their doctor's recommendation is being followed. This relationship essentially starts even before the patient goes to the OR. We contact MedMiami's office and we let them know this patient has surgery on this day. This is what's planned for them. But more importantly, when the patient is after the surgery, it's in our PACU. Our nurse in the PACU makes a call to the caretaker that's assigned to the patient and gives them a handoff. Anything specific about that patient that the caretaker should know as they're taking over their care at home, that gets communicated. So that's the first part in making sure that there's that continuity of care. But the most important part for us is that whatever goes on with the patient for the first couple of hours and then the next day gets communicated in real time to us. Dr. Asghari gets to see the patient vitals as they're taking it. Any comments about whether the patient has been taking their medication, what food they're eating, we get notification through a system that we share real time. Dr. Asghari, so your doctor gets to see that real time and is able to make a call to them and make a recommendation or make a suggestion as to what's going on. And Dr. Asghari feels that way, although he's not at home with the patient and he's not there, he feels that his eyes and ears are out there with the patient and is able to see what's going on with his patient even after they have left his operating room.
Revive does a phenomenal job at the pre-op, the surgery process, hands down, just phenomenal. So you'll hear from your caretaker a couple of days before your surgery, either a phone call or a text message. After that, it's the big day. It's surgery day, right? And that's where Revive is going to do everything that they do, their magic. So once we get that phone call letting us know that you are in recovery, at that point, we're dispatching your caretaker to get ready to head over. We're also dispatching the driver that we use. Once you arrive, the caretaker is going to be there to help you out of the car. So that's important. I don't think people really realize how important that is. So kind of think about it. You just went through surgery. You've been in recovery. Imagine coming out. It's a little bit hot. Your friend, your husband, your partner is the one trying to help you out. There actually is a specific way you should get out of the car. There are specific strategies and steps that our caretakers take so that you're not feeling any more woozy than what you need to. We're prepared with alcohol pads to have you smell if you feel faint. We're making sure that your head is not bent down, because sometimes this motion can make you dizzy and we don't want that. So our caretaker is going to use all those strategies to get you out of the car and get you into your home, your hotel, your Airbnb. It all depends. At that point, once you are in, that's when our magic begins. So the caretakers are going to hydrate you as best they can, make sure that you're positioned properly. So if you've had a BBL, that you're not sitting directly on your buttocks, right? That you're using your BBL pillow properly. So our team knows exactly what each position is and ensures that you're doing that. So once you're stabilized, we've got some vitals in you, we're going to send some vitals over. So here is something that is, I'm still so proud of what Revive and MedMiami have done with that. And there's not a lot of people doing it like that. Your vitals that are taken are in what we call real time. So what does that mean? Real time means if I take your blood pressure, your doctor is getting the exact reading at that time. So it's really neat. And it's not just your blood pressure, it's a full set of vitals. Yes, Dr. Scari looks at the vitals. I know you and I have touched base on that as well. He definitely does. So it's almost like having your surgeon there with you without really being there, right? He's one of the few surgeons that if there is an emergency or if we think there's an emergency, he'll head out to the hotel to see you. And that's not something that we find a lot. So that's amazing. So day 2 is what I call and my team calls the work day. You've got 5 hours to get some work in. So during that time, again, monitoring the vitals, monitoring your pain, and then we're also going to take pictures. And we're going to send those pictures over to Revive, and Dr. Scari can look at those pictures. This gives Dr. Scari the opportunity to look at that and make decisions if need be. So we're also doing a lot of post-op education because we're going to teach your companion what to do when we leave at the end of that 5 hours. So that can be as simple as how to get you into the bathtub, how to take you out, how to get you out of bed, how to have you sit down in bed, making sure that you're using your BBL pillow properly. We're also going to do some medication education. All of our caretakers are med techs. In order to even do any education about medication, you do need to be med tech certified. After that, we hope that your family can take care of you, but if they have questions, we have a post-op text line that you're able to text and ask questions to that our caretakers and our nurse has access to. You can always call Revive or MedMiami, which I think is really great, even that option. And I can say that Revive will answer their phone at all hours of the night.
So one of the other feedback that we get from the patients is that they feel that they were cared for. Their journey was not finished with the surgery alone, that this continuity of the care shows how much their surgeon and the office and the team cares for them. We really care for them as a human being, as a patient, and we care for them the way that we wanted our family to be cared for.
And it continues even days after their procedure. You're following up, we're following up.
Some of the questions that we get is, why is this care separated by 5 hours? 5 hours the first day, 5 hours the second day. Why is it not one continuous 10 hours, for example? We know that, the first couple of hours, it's a lot of chaotic things going on. You're in pain, you may have nausea, vomiting. They're there to support, to check everything. The second day, when things are calmer and you're more stabilized, it's time to educate. But more importantly, it's time that we want to have now some time has gone by and things start to declare themselves. That's the reason why, one of the reasons why we like to split up that and because the second day, certain things declare themselves differently. And we want to be there and we want to see that. One thing that really fuels this relationship is some of the bad rep that Miami has gotten for poor quality care and poor standard and safety care after the surgery. We wanted to basically show that this can be done safely if appropriate checklists are in place and with the appropriate support of trained professionals. We can make sure that not only you're going to a surgeon that knows what they're doing, but also your process of care afterwards is done in a scientific fashion with evidence-based medicine, with the experience that we have in order to make sure that you are being cared for appropriately.
The only surgery that's not risky is a surgery you don't have. Surgery is risky, not just cosmetic surgery.
Right. Any surgery.
Surgery is risky. Any surgery is risky. So our goal at MedMiami is to, one, educate, and then to change the perception of cosmetic surgery. So there is a safe way to do it. And that safe way, yes, while it does start with the surgeon, I agree 100%, it ends with the post-op team, and then it really doesn't end, it ends with a collaboration like Revive and MedMiami, working together to ensure safety, to work together for the best of the patient, and for prevention. And I always say prevention is better than cure.